Welcome, everyone. We're so excited to have you here. I am Diamond L. Young with Parkland Community Health Plan. It is so exciting to bring tonight's education class to you all on prenatal and postpartum health education. We have a health expert here with us tonight, Martha, who is with Dallas Healthy Start, and she is looking forward to also bringing you the best education possible. As we always state here at Parkland Community Health Plan, we are here to serve our members, and not only the members, but the community at large, and provide you guys health education over various topics that can help you live healthier and happier lives. So I will now turn it over to Miss Martha, and she will get us started.
Thank you, Diamondell. I appreciate you guys having me here. Yes, my name is Marta Maldonado, and I work with Dallas Healthy Start. And we provide free community health education classes. So the class we're providing today is a 1 hour version of our typically 4 to 5 hour session that we have. So if you do enjoy this class, please feel free to log into our um, Eventbrite link and register for the full series where we break out the sessions into 2 trimesters. But this one will cover all of them just in a very just kind of snapshot, quick version of the education. So I appreciate you guys having me here. So ready to get started whenever you are.
Awesome. So we can go ahead and have you start sharing your
Okay.
presentation, and we have turned the mic completely over to you.
Awesome. Thank you, Domino. Appreciate you guys having us here. Okay, so let me start sharing my screen here. Is my sound okay?
Yes, it is. It
Okay,
sounds very
awesome.
good. And then
Okay,
just to
good.
let everyone know, if you do have questions for Miss Martha, please write them down or remember them for after her presentation. She is more than happy to answer any questions that you all have. And of course, like us and share us on Facebook, Parkland Community Health Plan.
Awesome. Okay, so let me do this real quick because I forgot to add the sound and video, and I will need that because we've got a couple of short videos I want to show you all with this presentation. Okay, let's try this again. All right, can you see my screen?
Yes.
Okay, awesome. All right, let me move this stuff over and get into full screen and we'll get started. Okay. So at the end of this session, what I'm going to also provide is some resources that are here locally in the Dallas, Texas area. So please feel free to get information as much as whenever you need information. That way, if you are not local, you can look for similar programming in wherever you are. So they typically will maybe name different, but they have similar services. So, okay, so this is our Comenzando Bien program, and it is a program that is kind of designed behind the March of Dimes mission, which is very closely aligned to our Dallas Healthy Start mission, which is to reduce the mortality of infants and mothers after delivery here in the Dallas County area. And the reason we're so closely aligned is because we have the unfortunate disparities where we have a lot of women of color that actually have a maternal death after delivery. So that means basically moms have a great pregnancy. They're being cared for. The newborn is born healthy, but then mom has complications after delivery because a lot of times moms think that having a healthy baby is it. Moms are great at taking care of the babies after delivery, but they don't are not the best at taking care of themselves. So this is kind of also not only to reduce infant mortality, but even to give moms an information about postpartumly how to take care of themselves as well, because it's just as important in that sense. So let's go ahead and get started. So this is called Comenzando Bien. It's a program that actually was designed in Spanish and then translated into English, which is not very typical. It's designed to basically provide moms with accurate information on their prenatal and postpartum care, really provide us kind of a safe space for you to ask questions, because every pregnancy can be very different, whether you're a first-time mom or not. um, and really creating to teach moms an opportunity to kind of learn how to advocate for themselves, to become informed consumers on their pregnancy and postpartum care, and really encourage moms to be their best advocate, basically, because nobody's going to care about the baby more than they are. So it is, like I said, this is a quick version of all of our 4 trimesters, and it's broken out in 1 to 4. Obviously, we all know about the 3 trimesters of pregnancy, but the 4th one we consider postpartum care and newborn care for the mom after delivery. So a full-term pregnancy, a lot of moms think it may be about 39 weeks, but it actually is anywhere between 39 and 42 weeks. So it's really almost 10 months, not 9 months like we're completely used to forever. So the information that we'll provide is really kind of what to expect when you're pregnant, because a lot of times if we can reduce that anxiety or information for moms, that they can learn how to recognize things, a lot of things can be prevented by gaining access and recognizing those signs. So one, obviously our number 1 priority is having that full-term pregnancy. The full-term pregnancy, like I say, is 39 to 42 weeks. I know some moms start really getting nervous at about 39 weeks because they think they're going to go over and something's going to happen to baby. But we need to trust our care providers that are taking care of you, your OB clinics, because it's one of those things that it could have been a miscalculation. That's why they call it an estimated due date of your last period. Maybe you had it, maybe you didn't. So it's very easily, it's just medical science. It's not perfect. So there is an estimated due date that you're given. And we can go 2 weeks under that due date or 2 weeks over that due date. So it's very, very typical. But we really do want moms to recognize preterm labor signs. So that means that you're going into potentially into labor before 39 weeks. That creates a preterm baby. And when we have babies that are born pre 39 weeks, it's very difficult and a very stressful time for parents, because babies are not fully developed until about 39 weeks. So if you can see this picture in the middle here, you can see the difference between both of the babies' brains from 35 weeks to 39 weeks. It's a huge difference. It's almost twice as big. It has a lot of these little borders and crevices that have formed from those 4 weeks. And you also have, so that what this means is the developmental time for babies still is continuing to grow until they are delivered. So what we see typically that is affected within pre 39 weeks are going to be their lungs and liver, because those are the last things to finish forming at the end of the pregnancy. Their eyes and ears, so they could potentially have some risks for some blindness or even breathing issues. Also, what we have seen, which has been very, very recent, and that's why we like to keep things up to date, is the suckle, or basically the palate that a newborn has. We are seeing that that's one of the last things to finish forming as well. So what does that mean? That means that baby's going to have a hard time latching onto the breast or suckling on a bottle, because their palate and their suck, it basically their suckling is not as strong as a full-term baby. And those are difficult things to kind of go over, because what ends up happening is if baby's not feeding well, they'll not continue to grow. We want them to continue to grow after delivery. Obviously, they become failure to thrive concerns and those kinds of things. And it's a very stressful time for moms and for the family members that are caring for a newborn, to have them either stay in NICU or go home with some risks that they have to keep on top of and continue to kind of develop outside of the womb instead of them developing inside the womb. So it's a very difficult time. So recognizing those signs means that you are obviously going to start having false labor or Braxton Hicks at the very end of like your 30th week. So we do start seeing that, but recognizing the difference of full-term labor versus preterm labor. And you will start having these frequent contractions, which is very typical after 30 weeks. But if those contractions are getting stronger, they're getting more consistent, they're getting consistent within a time frame, so they're becoming less every hour or so, and you're continuing to have those symptoms, and you lay down and you rest on your left side and you're still continuing to have them, because usually false labor means that if you rest, you drink some fluids on and lay down on your left side for about an hour, those will discontinue or they'll get less. That means that they're probably false labor. But if those symptoms continue to increase and get a lot harder to deal with, then you most likely would be in preterm labor. So we need you to call your doctor or go ahead and go to urgent care, so that way they can see you and kind of just check baby. If everything's good, they'll monitor you for a minute and then they'll send you home. Otherwise, they'll continue monitoring you and kind of see how these pains and preterm labor signs are going. Now, you may have some belly cramps with or without diarrhea. That's very typical. But these belly cramps are getting stronger and are not going away. So it's kind of all goes aligned with those regular contractions that you continue to have. You feel some pressure. You're feeling any fluid leaking, whether it's discharge or actual fluid from your amniotic sac. Those are very, very big signs that something is probably going on. And if you're nowhere near 39 weeks, it's a problem. And if you get to the doctor, they can slow down that labor possibly, or at least get you some medicines that will help baby be prepared if they do have to deliver them pre 39 weeks in that sense. So basically getting there, they'll make the assessment and kind of figure out medical wise what's going to happen. Is it better to try to delay and stop labor for a bit, or go ahead and have you deliver, but under medical care instead of just going into full-blown labor at home? So keeping an eye on those things is very, very important. So that's our number one rule, is really recognizing those preterm labor signs, because there's a lot of things to do. Now, going into a typical pregnancy, you're going to have tests that you're going to have. There's a lot of screenings that they do every time that you have your OB checkups. A lot of moms really do kind of get frustrated because they're going to the doctor and they're only checking certain things, like you have to give a urine sample, they check your blood pressure, they check the measurements of the baby and the heart rate. Those are very 4 important exams that are done at every pregnancy OB checkup, but they get a lot of information on those exams. It's not just you're just doing the same thing every time. They're checking on how baby's growing. They're checking on how mom's health is by making sure your hormone levels are appropriate where you're supposed to be with pregnancy, making sure that you don't have any urinary tract infections, which is very typical during pregnancy to get, that you have the heart rate is where it's supposed to be for a newborn, for that baby at that stage. So there's a lot of things going on behind those tests that we don't recognize. So if you are concerned or you're not understanding everything, ask. It's your baby. Nobody's going to care about them more than you. And it is your right as a patient to really get that full information of what you want or what you need. Even if it's not in your language, finding someone that can explain it to you. Even if it's not at your education level that you understand and it's not clinical that you're understanding, somebody can make sure that you understand every piece of what is being done, what is occurring, and those kinds of things. It's not, it shouldn't be something that you're shameful of. They are there to make sure that you're receiving the full services that you need. So they're not doing you the favor. It's actually opposite. You're doing them the favor by giving them the service, so that way they can provide that service to you. You can choose to go anywhere you want. So if you're not comfortable with your provider, you need to speak up so that way your doctor you can find somebody that you're comfortable with, because we want you to understand what's going on. It's not just happening to you. We want to make sure that everything that's going on during your pregnancy is fully understanding what's going on and why these exams happen. Because a lot of times moms kind of keep quiet because they're embarrassed to ask, but then they're stressed, and stress during pregnancy is not very healthy. It's not healthy for mom, it's not healthy for baby. So we want to help kind of reduce those stress levels by something as simple as, oh, I don't understand what this test means. Can you explain it to me? And they will find a way to be able to explain it to you so you do know. One of the important things are the genetic testing. So the genetic testing gets done typically at certain states of your pregnancy, whether it's because of your age or just because of risk factors in your family. That's really important. A lot of moms' first instinct, because I've had a lot of conversations about these genetic testing, is, oh, well, I'm going to have this baby no matter what. It doesn't matter what's going on with the baby. And it's the genetic testing is not so much so you have to make a decision of what you're going to do with the pregnancy. It's really to educate mom. So if there is a genetic risk, doesn't necessarily mean baby's gonna be born with that, but that you have a higher risk of that, so you can prepare. So if baby has a risk for like a heart condition, so that way you can prepare the physicians and the care team that's going to be there for baby after delivery. If you don't have those in place, then you put baby at an even higher risk. Things as simple as that, having that explanation of what this means, what does this genetic testing mean, or what does this blood test mean, can definitely prepare you for things that you may have not been expecting for this pregnancy. So making sure you're following the recommendations of all the exams and understanding everything is really important. Now, chronic diseases are very typical and normal, and that includes like the flu, COVID, preeclampsia, which means high blood pressure during pregnancy, gestational diabetes during pregnancy. All of those things um, can be affect your pregnancy, but a lot of them can be managed. So it's really important, especially if you have pre-existing conditions like blood pressure, high blood pressure, or an autoimmune disease, or you have a lot of some of the other illnesses that some parents or conditions that they may have, like you have HIV, or you have some mental health concerns that you've been dealing with, medications that could potentially affect your pregnancy. All of these things need to be taken into consideration for babies that you're carrying, because it can affect the pregnancy. And it doesn't mean that it's going to hurt baby, but it has to be managed in a certain way. So really understanding your medical history is so important during pregnancy, so your doctor can provide you the best care, especially when it comes to certain things that parents tend to be embarrassed to share with their physicians. Like sometimes it could be using substances before pregnancy or even during pregnancy because you haven't been able to quit, like smoking or unprescribed drugs, or even just having a certain lifestyle that you may have to change and you're having a hard time with, are really important for pregnancy. One of the major things, obviously, everybody has heard COVID, having the vaccine or not having the vaccine. That's a conversation that's very personal for you to have these conversations with your physician and your care team. So that way you can make the most educated decision on what you're going to need. So for example, with COVID vaccine, I know, or the flu vaccine, some parents are very okay with taking it. Some moms are concerned. So having a conversation about this with your physician is really important. So that way you can make the best decision for you. Whether you choose to do these things or not, you're at least educated and understand why you don't want to do them is important for your physician to know. The COVID vaccine, for example, is one of the obviously the most present conversations that moms have with their physicians during pregnancy. If you choose to get it, great. There have been studies that it does not affect the pregnancy, but if you choose not to, that's okay too. But you do have to understand that if you do choose not to take like the COVID vaccine or like something like the flu, you have to be extra careful when it comes to your pregnancy and after baby's born, at least for the first couple of months, because they won't have a really strong immune system until they start having their vaccines after birth. So that means that if you have not had the flu or the COVID vaccine, you're going to have to wear a mask wherever you go in large crowds because you don't know what you're being exposed to. You're going to have to make sure that you wash or sanitize your hands frequently. You're going to have to make sure that whoever's around you is probably as healthy as they can be, or they have to mask up or you have to mask up. These are really important things to kind of reduce your risk. And the reason we want, especially moms during pregnancy, to reduce their risk of infection is because your immune system's already suppressed. Baby's taking tons of things from you. So as we are reducing your immunity, we want to protect you better. So those kinds of things are the things that you need to have in that capacity. So that way you can kind of stay as healthy as possible, because there's not a lot of things that we can provide for you because of the pregnancy. Same thing after delivery. We want babies to only be around people that are as healthy as possible. They're washing their hands. They're masking up if you're concerned about where they've been and what they've been exposed to. Those kinds of things are really important, whether it's you or baby, because your immune systems are a lot weaker than when you're not pregnant, or when baby has been started their vaccines at that point. So really making sure that you're understanding all of these things is important when it comes to those kinds of things. Two of the major things that moms deal with during pregnancy and moms don't fully understand is that these actually do kind of follow mom after delivery. And this is one of the two of the chronic diseases that moms can get during pregnancy that can actually have after delivery effects on mom, on like hemorrhaging or complications that moms may not recognize because they didn't realize that having these chronic diseases would not just go away after delivery. So it's really important for moms to understand that these gestational diabetes and preeclampsia can be managed. So you really do have to be under doctor's care, but also understanding what your care is after delivery. So gestational diabetes is obviously something that develops in moms after pregnancy with the exams typically about after 20 weeks. Even if you've never had a risk for it, some moms will develop a diabetes during pregnancy. So a lot of times it can be managed with nutrition and just your doctor's care. Sometimes there may be need for medication. That's why it's important to be under care and not missing your prenatal appointments if you do, whether you're feeling healthy or not. Now, preeclampsia is something different. It's something like high blood pressure, basically, during pregnancy. And again, moms may have never had concerns about this or risks, but now during pregnancy, they start having these symptoms that they don't recognize. Moms start getting really bad headaches. They start having kind of breathing issues that they don't understand where it's coming from. Some nausea sometimes, but one of the biggest physical things that moms realize is swelling. So the headaches and the swelling are probably the most prominent ones, or even like a pain under their rib cage that moms think it's like kind of like gastritis, or like having some something that you've eaten, something more of like heartburn and things like that, but it's actually right under the rib cage, which is kind of like a sharp pain, along with this headache, and then you also have begin swelling. Mom's feet swelling during pregnancy is pretty typical, but we're talking about swelling in other parts of the body, like the face, the hands, and those kinds of things, like overnight, really. Like you were fine one day, and then the next day you started having these headaches, and then all of a sudden you're swelling, you're retaining water. And those are really big signs of like having preeclampsia. Gestational diabetes is a bigger concern for baby because babies grow really fast with that kind of chronic disease. Now, preeclampsia is a little bit different. It affects mom more. So mom is at higher risk for cardiac arrest and those kinds of things. So both of these do affect the pregnancy. So we definitely need to have that managed. Okay, so let's go ahead and head into nutrition. So baby's born. We need to decide what nutrition we want to provide them during this time. And neither one, it's a very personal decision, just like the vaccines. You get to decide what is best for you, because I always tell moms, I know we get a lot of pressure for nutrition for a newborn with breastfeeding, and it is. It's actually the best thing that you can do to protect your baby because it's designed for your baby. Breast milk is only designed for your baby. Your body makes it. Your baby basically has the capacity to build up that supply. So everything that your baby needs in the environment that baby's going to be in, you're designing for them. Now, formula is a little bit different. Formula is designed to also provide nutrition just like breastfeeding does, because it has all the vitamins, all of those things, but it's not specifically designed for your baby. It's only designed for all babies because it has to feed any baby. It's not designed just for one particular child. It's designed for every child. So it definitely does provide some convenience and flexibility, but it doesn't provide the immunities that breastfeeding has. Now, formula is going to provide nutrition because it really does have all of those nutrients that breast milk has. But your breast milk is very, very kind of personally designed for a newborn. So that's the huge differences, but whatever works, because I do have some moms that are unable to breastfeed after delivery. As much as they would want to, they can't. It could affect baby, or it could affect them in having to go back on medications, having for mom to get back into care that they may have stopped during pregnancy. So it's not something that they're choosing to do, it's something that they have to do. Or I have moms that are going to go back to work and really don't have capacity to pump and store milk for baby. So again, it's a very personal decision. Babies are going to receive their nutrition no matter what. So we do like to talk about both of these options because these are the only two options babies and newborns need up to at least 6 months of age. After that, we start integrating um, foods, cereals, those kinds of things. But up to 6 months, these are the only two options that babies have to have. Anything else is not necessary. So keeping that in mind is really important, what's going to be the most convenient for you. So newborns are born with a really tiny, tiny stomach. They are born with the size of about a grapefruit. So we always talk to moms about that colostrum. If you can provide that colostrum at the very beginning, that's a wonderful start. It kind of sets up a foundation in their gut. So if moms are able to provide that, great. If moms are unable to provide that for whatever medical reason, a lot of the hospitals now have access to milk banks. So you can at least provide some of that foundation to baby's gut at the very beginning. So you can do donor blood basically from a milk bank. And that's pasteurized, it's processed. So it's been screened for any kind of illness or anything like that. So it's completely safe for baby to drink. So those are two options to at least provide that very beginning milk to baby to really form a really healthy and strong gut. And it doesn't need a lot. So that colostrum that mom makes at the very beginning is really tiny. It's like the size of a teaspoon, if you can see the grape. And then it obviously continues doubling up as the month goes by. But by day 7, most moms, if you are deciding to breastfeed, will have the full mature milk in that capacity. So you should be making that milk. Typically, the deciding physical factor of moms making milk after delivery is going to be delivering that placenta, really kind of starting. The breast automatically go into kind of feeding gear. Basically, the body realizes that hormone of that delivery of the placenta means I have to start making milk for my newborn to provide nutrition. So by day 7, you typically will have your full mature milk, and you can continue to breastfeed if you choose to do so in that capacity. So I'm going to show you this quick video on how the breast makes milk, just to give you an idea of where it is, because there's 3 things that we like to talk to moms about is understanding how your milk is made, also the positions baby's going to be in are really, really important. How baby's latching on, because that can decide on one, how much milk you're going to be making, how consistent it's going to be for baby delivery, for baby to be latching on, and really to make sure that you're not damaging your breasts when you are feeding, because that's the number one reason why moms stop breastfeeding is their breasts hurt so bad and they're so damaged by the latch that baby doesn't have well that it damages mom's breast. So it's really important for that baby to be latched on well in that capacity. And then learning how to hand express. Hand express will help provide mom some comfort if baby's not getting all that milk out. So really making sure that you are understanding those things are really, really important in that capacity. So let me go back here and I'm going to show you this quick video and then we'll talk a little bit more in detail of the other ones.
Breastfeeding really is amazing. Late in pregnancy, your breasts make small amounts of a thick, very nutritious milk called colostrum. This special milk is all your baby needs and is easy to digest, making it the perfect first food for your newborn. In the first few days after birth, colostrum changes to mature milk. You may also hear it referred to as your milk coming in. This mature milk coming in, this is more plentiful and helps your baby grow and develop. Let's take a closer look at how your body creates this perfect food for your baby. Inside a woman's breasts are milk-making glands called alveoli. This is where your milk is made and stored. When your baby latches onto your breast and starts to suck, your brain sends hormones to the alveoli. Prolactin tells the alveoli to make milk, and oxytocin tells the alveoli to release milk. This release of milk is called the letdown reflex. During letdown, you may feel a tingling sensation, or nothing at all. Once the alveoli release the milk, it travels through the milk ducts to your nipple. The milk comes out of the nipple openings into your baby's mouth. The more milk your baby takes from your breasts, the more milk your breasts will make to replace that milk. Your body naturally responds to your baby's needs.
So that's the reason, this is the reason why we encourage moms to breastfeed on demand from the very beginning, even if it's not a lot. At that state, because you're still making colostrum, which is a very small portion of milk, which is going to be more than enough for baby, but baby has to establish the milk. So the more baby latches on directly to mom, the more milk he's going to make. And that way you will be able to provide us what the baby needs because they're setting that standard. But if we have moms that are hand expressing or pumping or integrating formula because they think babies aren't full, then the breast is going to realize that and not make as much. So you're going to kind of almost go into that domino effect. The less you feed, the less milk you're going to make. So it's really important if you are choosing and are able to breastfeed at the very beginning that you're only breastfeeding on demand. Nothing else is being given to baby. That includes pacifiers, water, teas, those kinds of things. Baby has everything that they need inside your breast milk. They're basically designing that milk for themselves, so they are going to be able to get everything that they need during those feedings. Now, positioning is really important, and one of the things that will make mom comfortable to be able to breastfeed and have a great latch. All of the positions are great. There's not one better than the other, but there are some that are easier, especially if you've ever had a hard time breastfeeding or you've never breastfed before. So the football hold is one of the most, I think, important ones because mom not only has capacity to be able to latch baby on, but they have two free hands basically. So they can reposition baby if they feel like they're not latched on well. The sideline is great, especially if you have like a C-section or are having a really hard time positioning because baby's laying on the bed beside you. And you also have two free hands and capacity to be able to allow baby to position themselves really to latch on well. And it's very comfortable if mom's very, very tired. My only concern with the sideline is that safe sleep concern. Breastfeeding really does affect mom's tiredness because it's taking so much from you. You do get very, very sleepy and thirsty when you're breastfeeding. So making sure that somebody's aware that you're doing the sideline position at breastfeeding. So if you fall asleep, there's nothing wrong with that, but they can come and get baby and put them in a safe sleep area because they should not be bed sharing with an adult anytime. So really making sure any of these positions, the most popular one, which is kind of funny to me because it's the most popular one. It's the one parents always want to use because that's what we think it's the normal position. It's actually the hardest. Baby doesn't have a lot of neck control, so mom has to do a lot of work holding baby in position. And then, so mom doesn't have free hands. So the wrong positioning can easily happen in these kinds of positions. And what I always tell moms is baby should come to you, not you to baby. A lot of times at the clinics and things like that, I see mom hunched over trying to breastfeed baby, and baby should actually be coming to mom up to the breast. So that way mom's comfortable and can actually feed for a lot longer periods of time. Okay, so latching on means that baby's going to have to really be connected to your breast, not your nipple. And it's really, really important. So let me show you this latch video so you can see where and what it's supposed to look like.
The most important part of breastfeeding is knowing that your baby has a deep, effective latch. An effective latch allows your baby to get more milk and you to be more comfortable. Many babies latch on easily when mom is leaning back and relaxed with her baby on her torso, sometimes called a baby-led latch.
And then you can take away this hand and he can support his head and your breast with this arm and shoulder.
When you're leading your baby to latch, lean back slightly so you are relaxed and comfortable. Hold your baby close into your body with her tummy facing yours. Place your baby so her nose is right across from your nipple. Keep your hand behind the areola, the dark area around your nipple. You can interest her with a drop of expressed milk. Tickle her upper lip. When she opens her mouth wide like a yawn, pull her in quick and close. Look for the signs of a deep latch when you breastfeed. Your baby's mouth is open wide, her lips are flared outward, and her chin is pressed into the breast. You should be able to see more areola above her mouth than below. Your baby's ear and jaw should move when she sucks. You'll feel a pulling or tugging that's not painful, and you may be able to see and hear her swallowing. With a shallow latch, only the nipple or a small amount of the breast is in the baby's mouth. You may feel biting and pinching, nipple pain, and you may hear clicking or smacking sounds.
And then when she opens up her mouth wide, then you can just bring her in nice and quick.
In the early days, it may take some time and practice for your baby to latch on correctly. If your baby has a shallow latch, you'll need to re-latch. Break the suction gently to protect your nipples by pushing in on your baby's cheek or inserting a clean finger in the side of her mouth. Be patient with yourself and your baby. The more she breastfeeds, the better she'll get at latching on. If you have problems breastfeeding, talk to your nurse or a lactation consultant. They can help find the cause and a solution.
Relax your shoulder.
So you can see if baby does not have a good latch, your breasts are gonna be damaged. And a lot of moms think, oh, I'm breastfeeding, it's supposed to hurt. No, it's not supposed to hurt. It's supposed to be a little uncomfortable at the beginning because your breasts are obviously getting used to it. But pain, cracking of the nipples, those things are not normal. Mom is so full that baby can't latch on. And you're in so much pain that you can't even stand anything touching your breast. That's not normal. We need babies to, moms to actually connect with the lactation consultant. And that's step number one at delivery, is for you to get a visit from the lactation consultants at the hospital. Would be great. If you need help after the hospital, connecting with either your WIC programs or your insurance or those kinds of places would have like access to lactation consultants that can kind of walk you through what's going on if you have a face-to-face visit or have access to somebody walk you through, even over the phone or virtually, is really important. So that way you don't get so far into the issues that it's really hard to get back to state one, and that sort of thing. So making sure that your baby's latching on well is really, really important. So hand expression, the reason I like to just kind of touch on this is because if you're having difficulty latching baby on because your breasts are too full, maybe they didn't get all of the milk out from last feeding, your breasts are going to continue to fill. And all that milk is going to start making your breasts bigger and harder. So, and it becomes very, very painful for moms. We don't want mom to be that uncomfortable. So sometimes hand expressing before you're feeding will help soften the breasts. You can also put cold ice packs on the breast before a feeding. I'm sorry, warm compresses with like hot, wet towels over your breasts before a feeding, and then you feed baby. And then after a feeding, you can put ice packs on the breast over a towel. That helps reduce some of that swelling and makes mom's breasts a little more comfortable. If that's still not occurring and your breasts are still feeling very full, hand expressing will be very gentle for you to get some of that milk out before every feeding. You can put it in a cup or a bottle, or you can just get it out and dump it. It's up to you, whatever makes you more comfortable. That way you can have the next feeding a little bit more comfortable for moms, and mom doesn't feel like they are not able to connect baby, because you're going to continue filling every feeding. So remembering that is really important for that situation. So any typical feeding should include mom breastfeeding off of both breasts as possible. If baby's so full and kind of fallen asleep to connect with the second breast, it's important for mom to then start feeding with that breast the next feeding. And the easiest way that I tell moms to do that is to put a bracelet on, so that way you remember, because pregnancy brain is real. So we will forget which one we started last time and which one we're supposed to start this time. So just tagging your hand on that side, that way you remember that that's the side you're going to feed the next time, will make it kind of being able to empty the breast pretty regularly. And then burping isn't necessary, but you can. And this is one of those things that I usually tell mom, this is a great opportunity for partners to kind of get involved. Partners feel very left out. They obviously didn't have the baby. They obviously can't breastfeed, but there's a lot of things that they can still do, and we need to give that opportunity to them, so that way they don't feel like they can't do anything. Burping baby between breasts from switching from one to the other, helping mom get comfortable before mom starts feeding, so they can kind of calm baby and get them ready for that feedings, are great ways for them to kind of connect. If you start integrating bottles after like 4 to 6 weeks, having them feed baby with the bottles is a great help, because babies recognize moms and their smells and the hormones on the breast, so they don't take a bottle very easily for mom. So we usually tell moms to step out of the room, step as far away as possible, and then allow somebody else to bottle feed. When you start integrating those bottles at about 4 to 6 weeks is when we like to have that done, or later. So really that's kind of one of the ways that we can. So burping babies isn't as necessary with breastfeeding, because they don't take in a lot of air. Bottles offer a lot of air just because of the design. So that burping isn't as necessary, but they can, partners or dads can actually be the ones to do that for you while you prepare yourself and get comfortable again for the next breast to feed. You do want to alternate, like I said. So if baby's connected well, I always tell moms it's a great thing to do, because it'll take less time. Baby will get fuller, because a baby that's not latched on well is not going to fill, and they will stay on the breast for a long period of time. A baby that connects well will feed in about 15-20 minutes, and they will be completely full. So really making sure that you're connected well is going to kind of take practice. So don't be so hard on yourself. Just try to continue practicing, and the more you do it, the easier it'll become for you. We do want to feed babies on demand. We want to make sure that babies are eating 8 to 12 times a day, or that you're pumping 8 to 12 times a day. So some moms are uncomfortable feeding directly, which is fine. But then in order for you to keep up your breast milk supply, you're going to have to feed 8 to 12 times a day, or breast pump every 8 to 12 times a day, or formula feed every 8 to 12 times a day. It doesn't matter. Babies need to consistently feed in a 24-hour periods throughout the 24 hours. They shouldn't be sleeping through the night the very beginning. It's not normal for newborns to sleep through the night. You will begin to have failure to thrive issues. And what that means is babies are not gaining weight. Newborns lose weight at the very beginning, about 10% of their weight when they're born, and we need to put that back on within 2 weeks, or we begin to have failure to thrive issues, babies not developing the way we need them to. So it's important to, a lot of times moms think formula feeding is going to fill them for longer periods of time. It shouldn't. Formula should be fed 8 to 12 times a day, just like breast milk is. It's not the quantity, it's basically the quality. How many times you're feeding is what babies need, because they're burning calories very, very fast. So it's important. Number one golden question, how do I know if I'm feeding well, especially if you're only breastfeeding from mom directly? Obviously, we can't measure milk. So what we usually do is the dirty diapers. If babies are dirtying and wetting diapers, consistently every day and increasing every day, you're going to be good. That means babies getting enough fluids, babies digesting enough. Obviously, their diaper colors and consistency are going to change the type of stools they're having, but really wetting and dirtying diapers is the number one key to be able to see. If baby's not wetting diapers or pooping diapers, that means they're not getting enough fluid, and they could begin to dehydrate, they could begin to lose weight. Those are things that we definitely don't want for a newborn. So we want to make sure that they're wetting and dirtying diapers. So when should we be concerned and call pediatrician or take them to urgent care? If they're not latching on, and they were before, if they're having a really hard time waking, because babies should not sleep more than 3 hours at a time the first month. We have to wake them. But if you're having a really hard time to wake them to feed, we usually tell moms at about the 3-hour mark, if baby's still sleeping, we need to wake them up. Take their gown off, change their diaper. Even if they're not fully 100% awake, then we latch them on and feed them. They will fall back asleep, and they'll sleep for another 3 hours. They should not go more than 3 hours at a time in a 24-hour period. That's why we say 8 to 12 times a day. And that's in a 24-hour cycle. So at least for the first month, sometimes longer, depends on how baby's thriving. If your baby's having 4 yellow stools, less than 4 yellow stools by day 4 is not okay. So we need to contact doctor about that. If they're having less than 5 wet diapers at day 4, not okay. So we need to make sure we contact doctor. Or if by day 3 you start seeing kind of like this crystallized orangey red stain in their diaper, it doesn't necessarily look like blood, but some parents freak out because they think it's like a blood in there, but it's actually one of the high signs of dehydration. They're probably not getting enough fluids in. If they haven't gained their weight back from birth at day 14, so basically that if they lost 10%, they haven't gained that 10% by day 14 is not good. Skin and eyes becoming yellow, or what we call jaundice, is very typical more often for my breastfed babies, because your breast milk isn't making vitamin D yet. Now, when we do formula fed babies, they tend to get that from the formula, because remember I said all of the vitamins and nutrients are put in there. It's kind of a man-made item, so they put those in there deliberately. So babies that are breastfed are not making that, and so they are not at an age, they haven't developed that in their body yet, so they're not making natural vitamin D, so we have to provide that. So we usually tell breastfed moms to take them out to the sun, put them in the sunlight inside the house, put them in a diaper and just let the sun rays kind of hit their skin. It helps reduce that jaundice. Now, if baby starts really having a hard time eating, very irritable. They're just not eating. They're more sleepy. Their eyes are turning yellow. We have a concern for jaundice, so we need to get them checked out and see what the doctor wants to do, whether sunlight will be enough or they need to have that artificial lighting at the hospital. And again, that 8 to 12 times a day in a 24-hour period. Now, bottle-fed babies are a little bit different. So we usually tell moms, if you're choosing not to breastfeed anymore or you want to pump and store, that's very easily to be done with breast milk. We're just going to be continue feeding the same, whether it's formula in the bottle or breast milk in the bottle. You have to pump at least 8 to 12 times a day. We're feeding them 8 to 12 times a day and those kinds of things. So the one thing that I do tell moms, let me go back here, is a lot of times moms are very defeated when they start bottle feeding, especially when they start using formula. So I see a lot of babies in the carrier with the bottle propped in their car seat, or I see moms with the baby on their lap and feeding them this way. They're basically at their lap feeding them. So what we try to work with moms is there's nothing wrong with bottle feeding. As long as you have made that decision on your own and this is the way you want to feed your baby, it's your decision. But I don't want you to feel defeated. I don't want you to be so hard on yourself because you're not breastfeeding like every other mom that you know. We want to duplicate what you're doing with breastfeeding. So as you saw in the videos, babies being held here at the breast, moms talking to them, moms interacting with them. Do the same thing with the bottle. That's one of the major things and why we want to breastfeed, because that connection, that bonding time is really important. So duplicate those things when you're bottle feeding. That's something that's very easily done. You just have to be deliberate about it. With breastfeeding, it's natural because baby's so close skin to skin. So do skin to skin with them while you're bottle feeding them at home. Take your shirt off, just lay them on your skin and bottle feed them. That provides that same connection and those hormones that babies can smell, just like a breastfed baby. So really being able to duplicate that is important. Storing milk, whether it's formula or bottle or breast milk, is all the same. We want to keep it in the refrigerator at room temperature no longer than like 4 hours. In the refrigerator 4 to 5 days if you're preparing milk for a period of time. And then in the freezer about 6 to 9 months is very average. So making sure that you're storing milk appropriately, and it doesn't matter if it's breast milk or formula. We don't like to microwave breast milk or formula. We only warm up the water and then put the bottles in or mix the formula with that warmed up water. It depletes the nutrients in there when we microwave things. So really keeping that in mind, unless it's an emergency, really trying not to microwave the formula or the breast milk is really important. Warming it up in the bottle in hot water is probably the best way to do that. Let's go into labor and delivery. So labor and delivery, a lot of moms are really nervous about this because they are not sure they're going to know what's going on. So the number one thing I tell moms to kind of help reduce some of that stress is a birth plan. You don't have to share this with your doctor. You are more than welcome to, obviously, with your care team when you're delivering, but this is really more for you and whoever's going to be in the hospital with you. So you do have to make a decision of who's going to be in the birthing room. It's really important. So sharing this birth plan with that person that's going to be in there with you is important because they're going to be your voice. You are not at a place where you make decisions at the bedside when you're in labor. You are in pain, you are distracted, and it's not the best time to make decisions. So really making these is the reason why I like birth plans. Talking and having this conversation with whoever's going to be in there, like, hey, this is what I want. This is when I'm going to want it. This is my sign to you that I don't want this anymore. All of those things, kind of a game plan for you. So that way you can feel comfortable. Refusing pain medication or wanting pain medication. Those kinds of things are decisions that you have to make. Now, the caveat is if your baby's in danger or you're in danger, then kind of birth plans or decisions kind of go out the window. But outside of that, you do have a lot of control of certain things in that sense. So really making sure that you're prepared and ready, and whoever's there with you is going to be your voice and your advocate for that is really important. So signs of labor are the other things. How am I going to know? So the body changes, obviously, and sometimes we recognize those signs, sometimes we are not. So as the body's changing, obviously, you're going to, typically babies are up almost into our rib cage when they first start growing, and then they start descending down towards the pelvis. During those times, that's why moms have a really hard time sleeping and breathing, because baby's almost inside your lungs. And so when body starts changing and baby starts preparing for labor, you're going to start having baby drop further into your pelvis. And that's what we call lightning. So if you can see here, before lightning, baby's up a little bit higher of the pelvis, but after the baby drops, is what typically people will say. After the lightning happens, your baby is more into your pelvis. So you can see baby dropped here. And this is when moms really start having some sciatica pain, pelvic pain, pressure in the pelvic area. They feel like baby's going to drop out as they're walking, or even cramping on their thighs is really, really normal, because baby's compressing those nerves right there. So it's very typical for that pain to happen. Now, contractions may start happening at about 28 to 30 weeks, but it's what we call false labor. So those false labor contractions are actually helping baby with lightning and positioning them in down position into the pelvis. Because sometimes even when you start lightning, they may still be breech, which is their bottom first on the pelvic instead of their head. But it doesn't mean they're going to be born that way. It just means that they're kind of getting prepared and being there. One of the other things is also that mucus plug. So basically, when you're pregnant, your mucus plug is covering and has your cervix basically closed. But when you lose that, it basically starts opening up that cervix and thinning it out. So that means that you're not going to go into labor tomorrow, but it means your body's really kind of taking that next step and preparing. So you may start having false labor contractions more often, that feel kind of like cramping during your period is what they feel like, but they start getting stronger and you start feeling more pressure, those kinds of things. Most moms don't even realize when they lose this, because remember, your cervix is really tiny. So some moms don't even realize it has come out, but some moms freak out when they do see it, because it's very gooey, kind of boogery consistency that comes out. Sometimes it's clear, sometimes it's red, sometimes it's a little brown. So moms don't know what that is, and that's your mucus plug. So once that happens, then you will start dilating. And again, you won't dilate tomorrow completely to what have baby in labor, because I have seen moms lose their mucus plug 4 to 6 weeks before delivery. So it just means your body's again going that next step and preparing. Now, any leaking is not okay. So if you start going to the bathroom and you're leaking any kind of fluid, then you definitely want to check in with your doctor and get assessed, because any fluid leaking obviously can be dangerous, because baby obviously doesn't have that fluid that they need in the amniotic sac, or mom can get an infection from even just a leak. So we definitely want to get checked out and that sort of thing. So the biggest question is, how do I know I'm having Braxton Hicks, not contractions for labor? They're very different. So Braxton Hicks are not regular. They do not come getting less and close together every time. Where labor contractions, actual contractions, will last about 30 to 70 seconds consistently, and then they start diminishing. So basically how we time contractions is from when that pain ends and then the next one begins. So they start getting closer and closer together consistently. Like they started at 10 o'clock this morning, and then you had another one at 10:40, and then you had another one at 12:30, and then you had another one at 1 o'clock. So they're not consistent. Those are Braxton Hicks, and that typically starts happening at the very beginning, about 30 weeks or so. Now, labor contractions start really becoming regular. You're having one at 10:30, one at 11 o'clock, one at 11:30. So consistently, they start diminishing closer and closer together, really. Now, true contractions, you will continue happening no matter what you're doing. whether you're sleeping, whether you're resting, where false contractions do stop when you rest. So if you're in the like laying down position and you're drinking fluids and you rest for about an hour, they can go away. That means they're probably Braxton Hicks. Now, if they continue, even though you've been resting for an hour, they're not changing, they're still continuing consistently, then they're probably real labor. The strength starts getting stronger with real contractions. The Braxton Hicks, not so much. They continue to kind of be the same most of the time. A little bit painful, but not getting stronger and stronger. And then, of course, where the contractions are coming from are very, very different. Where Braxton Hicks are almost just superficial, they kind of tighten your belly, where real contractions are really kind of more deep inside. Remember, if you've ever had problems with like cramping during your periods, it's inside. Even if you take a Motrin, it's not going to completely make it go away. Those kinds of pains are more inside the uterus than the superficial outside the belly. So that's a huge difference there. So with that mucus plug you lose, like I said, you're going to start thinning out and opening your cervix. So the two things that we look for a full-blown labor to be kind of active and mom to start pushing, our goal is to 10 centimeters open, so basically like the size of a grapefruit, and you're 100% effaced, so you're thinned out. Your cervix here, if you can see the difference, how closed and thick it was, now it's getting thinner and more open with that cervix dilation. So typically I tell moms you will start dilating and you will start effacing, but you're not, our goal is to get you to 10 centimeters dilated and 100% effaced. So a thinned out cervix and an open cervix to 10 centimeters. So those kinds of things you'll be checked for as you're getting those physical checks. So they'll give you a number. For example, they'll say, okay, mom, you did lose your mucus plug because you recognized it, but right now you're only 2 centimeters dilated and 20% effaced. So that means you're only 2 centimeters open, and 20% of that 100 is thinned out. So that's kind of gives you an idea of where you are. Walking during this phase is going to really help. But if your body's not ready to deliver, you can walk 100 miles and it's not going to matter. So if it's time, it's time. If it's not, then it's just not time, and that's okay. Baby kind of gets to decide this at this term. Pain management, very easy. You can do natural, which are with birthing classes. So if you do want to do more of a natural sense, do a birthing class. If not, then you can ask for pain medication at the bedside when you are in labor. So really making sure that you know what you're getting, whether it's the epidural, which is that needle that goes into your back, but then they put a catheter in so the needle doesn't stay in there, and it provides medication in the spine. And some moms have side effects from it, some don't. But again, it just kind of depends on the placement, and any complications varies from mom to mom. Now, the analgesic is an IV version of the medication, so it's a little bit gentler on the body, but either one of these, you're not going to be able to move anymore. And remember when I said the more you walk when it's time for labor, the easier it's going to be. And it's going to progress labor more. But once you get these pain medications, you are unable to move. So you're kind of stuck at where in the position you're in, and you have to stay there. So labor may be gentler, so you won't have pain, but it may be longer just because you've gotten the pain medication and you're not moving anymore. So those kinds of things. Now, hospital check bags are great for you to prepare. I usually tell moms 4 to 6 weeks out because you never know. You can go to a doctor's appointment and your blood pressure can be up and they're gonna inpatient you. So that way you have your stuff ready, whatever you need for you, baby, and even the person that's gonna be staying with you at the hospital, if that's allowed, are kind of your personal choices of what you need. So really making that. These are birthing classes that Pampers does for free online. They're all pre-recorded, so you can take them at any time. They do have birthing classes. They do have other topics. It's just a matter of you getting on their website. It's the Pampers childbirth education classes. If you Google that, their website will come up and they're all free. Just a matter of you signing up with them. All right, last but not least, obviously, after baby's born, we still have a lot of work to do, even though sometimes we forget we do. We think it's just caring for newborn. So we want to make sure that mom's got a great diet. We don't have any specialized diets or things that you have to discontinue from your diet when it comes to that, because mom's breastfeeding, or even if you're not breastfeeding, mom has a lot of recovery to do from that pregnancy. So really making sure that they have a full, colorful plate is really important, that you're eating fruits and grains and vegetables and proteins. And it doesn't have to be the normal. If you're not really into proteins right now, getting proteins in other things like beans or nuts or those kinds of things that can provide some protein for you is really important. But really trying to eat, even if it's small portions, trying to eat these things, especially with things with calcium and iron. Continuing to take your prenatal vitamins is really important, because mom takes about 2 years to actually uh, um, kind of get back to normal state before the next pregnancy. So it takes about 2 years to moms to come back to that normal state after a delivery. Exercise is important for any mom, whether you're doing it in the home or even just getting out and walking with baby in the stroller, or even getting out on your own is really important. Mom's mental state is just as important as your physical recovery. We want moms to be able to kind of decompress, whether it's a hot bath or a walk by yourself or even going shopping, whatever you're enjoying to do, getting away, even if it's just for 30 minutes or an hour, perfect. Just so you have some you time is really important. This is the very beginning. I always tell moms, we don't have to do everything. Moms think that they have to take care of the baby and everything else. Allow the people that are visiting, because they're not going to be there forever. They come see baby, let them have the baby. You go out for a walk for 30 minutes, or you go take a nap for 30 minutes, or a hot bath for 30 minutes, whatever you need, because they will be gone within a few weeks. Believe me, they come and love on baby, and then they're gone back to their normal lives. So you recovering is really important. So one of the major things that we see when moms are postpartum is the complications after delivery that moms don't pay attention to. So we like to talk about the signs and those, what's normal and what's not. So any signs of fever, any signs of pains that won't go away, especially if you had an episiotomy or a C-section, bad odor or swelling, those kinds of things are not normal. We need you to check in. Moms typically have a postpartum checkup 4 to 6 weeks after delivery. Super important for moms to make that. Moms are not the best at making that. So really making sure you have your postpartum, so that way you can talk to them about any concerns. You can start thinking about family planning for the next pregnancy, if you choose to have one or not going to have one. So those kinds of things are really important for you to make sure that you have happen. Medications, making sure you're taking them as prescribed, checking in with your doctor if you're taking anything else, continuing to do your prenatals for a little bit, especially if you're breastfeeding, is going to be really important, because we don't always eat what we're supposed to eat. So this will help kind of put back in some of those vitamins we're not eating. Now, bleeding is normal, but it's not normal for you to start feeling dizzy or faint when you're bleeding after delivery, or if you're passing clots that are larger than a quarter size, not normal. You have bleeding that won't stop. Basically, you're soaking a pad within an hour. Every hour you're having to change a pad. Not normal. Okay. So those are things that we need to check in with doctors if you're having any concerns or thoughts. Even call your nurse line. If you have health insurance or Medicaid or CHIP, you have a health and 24 hours, 7 days a week, 365 days a year, access to a nurse. Call somebody and check in and see what they advise you to do, so that way you can find directions. If you're having headaches, you're feeling confused, you're having pain that's getting worse as days go by, you're having trouble breathing, any chest pains, your blood pressure is going up more than normal. So basically, if you're having more than 140/90, we're concerned. We need you to check in with somebody. Call your doctor, go to the urgent care, because a lot of these things can basically mean that you're having really serious complications. And unfortunately, you can die from these complications, and we need somebody to look at you and assess what's going on. So really making those things are really, really important. One of our major concerns is depression or postpartum blues for moms. What is the difference between those? Because they're very similar. So baby blues typically will go away after a couple of weeks. Okay, so your baby's born within about 7 to 14 days, a little bit, give a day or two, you're having these signs of depression, kind of feeling restless, anxious, grumpy. You're crying for every reason and you don't even know why. When somebody asks you why you're crying, you have no idea. You're just not feeling like yourself. You're having a hard time concentrating. Those kinds of things are pretty typical because remember, your hormones were up here and now they're dropping really fast. So your body's kind of trying to catch up with everything. So these things are normal to happen within the couple of weeks. If they're continuing after a couple of weeks and getting worse, then we need you to talk to someone. Family members are first ones to really start seeing these things, like you're afraid to carry baby or be alone with them. You're feeling very anxious and panicky, like everything is like concerning to you. Everything is like freaking you out. You're really not feeling comfortable with the energy that you're having. You can't focus. You're just feeling kind of not yourself. You're really kind of disconnecting. So, like families that are coming by, you don't want to see anybody. You're not bathing. You're having just this lack of feeling that you thought you were going to have for a newborn after a couple of weeks, that you're just not settling in with this newborn here. You start having these obsessive thoughts and repetitive fears that something's wrong with baby or you're not able to care for baby. You're getting a little confused. These are signs that really something else more serious is going on than baby blues. And this can continue up to 12 months. Moms may have had some depression before and then just kind of didn't get recognized, and now it's even worse after delivery. So it's really important. It's real. Depression and postpartum blues are real, but they're really important to recognize when it's normal and when what's not, so that way you can get help. And it doesn't always mean that moms have to be on medication, because that's the first thing. I don't want to be on medication and depend on something forever. It's not even about that. It's about kind of um, breaking down what's going on. Why are you feeling this way? Is it something as simple as maybe giving you some newborn care classes or just talk therapy? Those kinds of things. Every mom needs something different, and we can't give you what you need if we don't kind of talk through everything that's going on and why these things are going on. So really recognizing this and getting somebody to hear you is really important. So you'll fill out postpartum screenings at pediatric clinic appointment and your postpartum. Really important to be very, very open and honest with those questions, because that way you can kind of start seeing what's going on. And if there's something more towards the depression side than the postpartum blues side, is those screenings are really important to have done and be honest with them. Self-care kind of goes back to that whole exercise, getting away, doing things for yourself. Don't be so hard on yourself. Every baby's different. We're always going to have different struggles every day, but it's just kind of keeping in mind that, you know what, it's not, it was really difficult today. We're going to try again tomorrow. Having that support system in the home is really important, so they know kind of how to help you, because if you're trying to do everything and you can't, nobody knows that you're having a hard time. Don't be so hard on yourself. Ask for help. We really do want moms to take care of themselves after delivery. Postpartum conditions that can continue on after delivery, like we talked about, diabetes, the preeclampsia or high blood pressure. We have some moms that kind of have worse symptoms with if they have asthma, that GERD, that kind of like that it's kind of like heartburn, indigestion, those kinds of things that they may have had during pregnancy. It's gotten worse after delivery. All of these things are really important for you to kind of keep an eye on. So if you had any of these things before pregnancy, during pregnancy, you're probably going to have these conditions for a bit after delivery. And we need to make sure that we know the signs or the warning signs for these kinds of things and talking to your doctor. Now, healthy moms mean a healthy baby, because if moms are not okay, babies are not going to be okay. Nobody in the house is. So we want to make sure that moms are taken care of, getting help if they feel like they're having more than baby blues, making sure that moms are having their well women checkups and their postpartum checkups, those kinds of things. There's a lot of resources that can be accessed. family planning is covered by most insurances, your Medicaid or your CHIP, or even this program here, this Healthy Texas Moms, has a great program that covers women with their basically their women's health services, as long as you qualify. So really finding out about these things is really important. So that way you can make sure that everything is taken care of after delivery. Car seats are just as important. We talk about car seats all the time during pregnancy because babies have to have a car seat up to 8 years old in Texas. They should stay rear facing up to 8 years, up to 2 years old is what the recommendation is by the Academy of Pediatrics. There are tons of resource programs in the community, even if you already have a seat, to have you install it correctly, because out of every 4 to 5 seats, we actually see 4 that are installed incorrectly. So making sure that you have that is really important. So finding a resource is really important. You can call 211, you can Google car seats. I'm going to put our Eventbrite link on the messaging so you guys can have access to that, because we do car seat classes. They are full, but if you book your class about 4 to 6 weeks out, you may be able to get into the following month. So there are a lot of resources out there that can provide that. Newborn screenings are just as important as everything else. You'll get first screenings at the hospital, and then they'll give you a guide at the hospital or at their first pediatric visit after they are discharged to kind of keep these screenings up to date. It's really important to have those because these screenings actually help moms kind of plan what's going on with baby, having their immunizations, how are they growing, are there any concerns? Those kinds of things are really important. So community resources we've got available. March of Dimes has tons of things for mom during pregnancy, or even if you have a baby that's born early, they have NICU support, those kinds of things. These are all kind of the websites that we talked about on the presentation about the Pampers websites for pregnancy, exercise 211 to gain access to resources in your community, those kinds of things. These are local websites that we use all the time. You can possibly get a breast pump from your insurance or Medicaid. You just have to kind of follow the process that your insurance has. Really getting WIC is one of those things, is one of the easiest screening processes than any kind of other benefit in the Dallas County area. Or even if you want to apply for Medicaid or CHIP or our food stamps, those kinds of things are all done through the 211 service or the Texas benefits. So these are all resources that can help moms before and after, or during and after pregnancy. So this is my contact information. If you have any questions, even if I don't have the answer, I can connect you to somebody that can give you the answer. And I did forget to tell you, I'm not a nurse, I'm a health educator. So any clinical stuff that comes up, I typically try to refer to our nurse line or your insurance nurse line, so that way you can get those services yourselves. So I'm sure I've gone over, because I always do, but are there any questions by anybody that has that is joining us? Let me stop sharing my screen here. Okay. I know I've gone over.
No, this was wonderful, Martha. Thank you for the abundance of
Yes.
information. You really dove deep, into information from
Thank
mothers that
you.
is greatly needed. So that way they can start to understand those kind of early warning signs and what to look out for. And that's what's most important. And also being open to have those communications or positive communications with their providers if they feel like something is going on. No question is too small. So we really
Definitely.
appreciate that. So
Yeah, because
Martha,
it's really easy to kind of just not have our questions answered, and then we start thinking about it after we leave the doctor's office. Oh man, I forgot to ask this, or those kinds of things. It's really, really important. So I'm gonna put our link, because obviously we have other classes that we're gonna come back obviously in the summer and the fall to do some of our other topics. But if you would like to join us before that, these classes are booked all year long. We have sessions all year long. We even have a group that we're doing with teens now, quarterly, that is only specifically for teens. It's done in the evenings virtually, so that way they don't have to miss score or anything. And our teen parents actually do get a car seat with it. So, enrolling in that for our teens is a wonderful opportunity as well.
Yes, thank you so much for providing that information in the chat. For those that were not able to attend today with the live session, please know that this video will also be saved on Parkland Community Health Plan's YouTube channel. We will also have this video saved on our social media channels, all outlets. So we are on Facebook, we do have Twitter, and we also have LinkedIn. And as stated, you can find this video on the YouTube channel. So if you guys have any questions or concerns, do not hesitate to reach out. You can also reach out to us, and we can get your questions over to Martha or get you directly connected to Martha. Our email is pchp_community_outreach@phhs.org. Again, that's pchp_community_outreach@phhs.org. We would be happy to connect you all. Martha did provide the link in the chat, and we will make sure that is saved with the recording. Again, we will have these monthly education sessions each month, the third Wednesday, starting at 7 p.m. We will have both English and Spanish classes. So if you are bilingual or Spanish speaking, Martha does offer this class in Spanish as well. So that video will also be uploaded to the YouTube channel. Again, we appreciate you so much, Martha, for providing this education to the community. It is awesome. We look forward to having you back again for the community and everybody else. We appreciate you guys. We hope that you've learned a lot. And until next time.
Thank you, everybody. Have a great afternoon.
Thank you.